Hello guys. So today we are going to talk about the immune system disorders. So let's begin. Actually, I don't write on the paper because my handwriting is very good, very bad, and often I write very slowly. So, so autoimmune disease. Microbial agent infection with resultant tissue necrosis and inflammation can cause upregulation of co-stimulatory of course, molecules on APC can break down energy of T cells. Okay. And the display of tissue antigens may be altered by a variety of environmental insults, not only infections. Autoimmune disease. Auto disease. So we have this systemic lupus erythematosus, systemic lupus erythromatosus, erythromatosus. Okay, autoimmune thrombocytopenia, autoimmune thrombocytopenia. Okay, autoimmune atopic gastritis, autoimmune atrophic atopic gastritis. Okay, pernicious anemia, pernicious anemia. Okay, myasthenia gravis, myasthenia gravis. Then Graves disease, Graves disease. Okay. Then good pasture syndrome, good pasture syndrome, good pasture syndrome. Type 1 diabetes mellitus. Okay. Type 1 diabetes mellitus. Rheumatoid arthritis, rheumatoid arthritis. Um then multiple sclerosis, multiple sclerosis. Okay. Systemic sclerosis, systemic sclerosis. Okay. Hashimoto thyroiditis, Hashimoto thyroiditis. Okay. Then Sjogren syndrome, Sjogren. I don't know if I am pronouncing it right or wrong, but it is Sjogren, Sjogren syndrome and Crohn disease. syndrome and CROHNDIS disease. So these are the examples of autoimmune disease. These include the systemic lupus erythematosus, autoimmune thrombocytopenia, autoimmune atopic gastritis, pernicious anemia, myasthenia gravis, Graves disease, good bastard syndrome, type 1 diabetes mellitus, rheumatoid arthritis, multiple sclerosis, systemic sclerosis, Hashimoto thyroiditis, Sjogren's syndrome, and Crohn's disease. Now let's talk about the systemic lupus erythematosus. So SLE is a multi-system autoimmune disease. Multi-system, okay, is a multi-system autoimmune disease. Okay, affects principally the skin, kidneys, serous membranes, joints, and heart. Okay, so affects primarily um skin, then kidneys, kidneys, then serosal membranes, then joints and heart. GRT. Immunologically, the disease is associated with an enormous array of autoantibodies, classically including the anti-nuclear antibodies ANAs. Okay, so in this type of disease, antibodies are predominant in the blood. Okay, the diagnosis is established by demonstration of four or more of the criteria during any interval of observation. As with many autoimmune diseases, there is a strong, approximately 9 to 1 female preponderance, and the disease affects 1 in 700 women of childbearing age. Okay, so this disease is more seen in females than in males. Okay, so immunologically, logically, uh, there is there is abundance of auto antibodies, particularly particularly this anti-nuclear antibodies. Yeah. These are also called as ANAs. Okay. Okay. So the diagnosis of demonstration of four or more criteria during any interval of observation. As with many autoimmune diseases, there is a strong, approximately 9 to 1 female preponderance. So female preponderance is seen. Okay, and affects one in one in 700 women of childbearing childbearing age. It means that the women who are pregnant, they are more susceptible to to the systemic lupus erythematosus. Etiology and pathogenesis. So etiology. What is the etiology? Etiology. So fundamental defects of in the SL is a failure of to maintain self tolerance. Now what is this self tolerance? So self tolerance is basically the ability of T cells to not kill the tissues, self tissues. Okay, there is no self tolerance. Okay, so in this case, there is a failure of self tolerance. Like the this T cells, they kill the normal tissue. Okay, so genetic factors, many lines of evidence support a genetic predisposition to SLE. Family association, family members have an increased risk for development of SLE. Okay, genetic deficiencies of cholesterol pathway covalent protein, especially C1q, C2, or C4, are seen in about 10% of patients with SLE. Okay, the complement deficiencies may result in defective clearance of immune complexes and apoptotic cells and failure of B cell tolerance. So there are many etiologies like let's write it down. Genetic factors, genetic factors. Then familial association, familial, okay, and genetic deficiencies of classical pathway. Now, what is this? What is this classical pathway? So let me remind you that the classical pathway, it is a pathway through which the complement proteins they get activated. So the complement deficiencies may result in defective clearance of immune complexes. Okay. So okay. Sorry. Especially C1, Q, C2, and C4 or C4. Okay. This produces the defective clearance of immune complexes and apoptotic cells and failure B cell tolerance. So complement deficiencies may result in defective clearance of immune complex, then and apoptotic cells. Okay, and failure of B cell tolerance. B cell tolerance. Okay. Okay. So environmental factors. Okay. So there are some environmental factors which can cause this disease, systemic lupus erythematosus (SLE). So they include UV rays, ultraviolet radiation, sun exposure. Cigarette smoking has been shown to cause this SLE, and sex hormone had been thought to exert an important influence on the development because SLE is 10 times more common in women. Yeah, this is a woman. What is it called? Woman preponderance. Preponderance. Yeah. Preponderance. Okay. So environmental factors like okay. So like UV radiation. Okay. Then cigarette smoking. Cigarette smoking. Okay. Then third one is sex hormones. Sex hormones in female. Okay. Because SLA is 10 times more common in women during reproductive years than in men of similar ages, but only 2 to 3 times more common in women during childhood or after age of 65. Okay. Drugs like procainamide and hydralazine can induce an SLE-like disease. Immunologic abnormalities in SLE studies with B cell from patients with SLE suggest the presence of defects in both central and peripheral tolerance. Okay. According to this model, UV irradiation and other environmental factors. Okay, so insults lead to apoptosis of cells. Inadequate clearance of nuclei of these cells results in large burden of nuclear antigens. The self-reactive B cells are stimulated by the self-nuclear antigens and antibodies are produced against the antigens. The nucleic acid component engage the toll-like receptors and stimulate B cells to produce antibodies. Autoantibodies. Okay. दोबारा. So, according to this model, UV irradiation and other environmental insults lead to apoptosis. समझा. Inadequate clearance of nuclei of these cells results in a large burden of nuclear antigens. Okay, ठीक है. सो इनका क्लियरेंस जो है वो ठीक से नहीं होता. तो ठीक से नहीं होने की वजह से क्या होता है कि न्यूक्लियस जो है वो एंटीजन की तरह काम करता है. ओके. The self-reactive B cells are they are stimulated by the self-nuclear antigens, okay, and antibodies are produced. Okay, so okay. Oh, okay. सो सबसे पहले क्या होता है कि यूवी रेडिएशन की मदद से अपना अपना सेल जो है वो डिस्ट्रॉय होता है. ओके. डिस्ट्रॉय होने का क्या होता है कि एपोप्टोसिस से उसकी मृत्यु हो जाती है. ओके. मर जाता है वो. फिर उसके बाद क्या होता है कि न्यूक्लियर जो होता है कि inadequate clearance of nuclei of the cells results in a large burden of nuclear antigens. ठीक है. सो न्यूक्लियस जो है वो क्लियर नहीं होता ठीक से ऑफ द सेल्स which are which are destroyed by the apoptosis. Okay. So हाँ. सो उसके बाद क्या होता है कि अभी ये जो सेल्फ reactive B cells है they will produce the antibody against this nuclear antigen. Okay. They will produce the antibody against the nuclear antigen. Okay. And this and this will cause the systemic lupus erythematosus. ठीक. समझा. हाँ. Pathogenesis. UV radiation. It causes the अरे ये तो हमने drugs like pro procanamide, procanamide, and hydralazine. Hydralazine can induce SLA like disease. Okay. So person UV radiation नहीं यूवी रेडिएशन से क्या होगा कि अपना जो सेल जो है इट विल अंडरगो द apoptosis, but the thing is that this apoptosis will not undergo properly. So the nuclear fragments will still they will still remain in the blood. Hmm. So inadequate clearance of nucleus. So then, inadequate clearance in nucleus. Then what happens? Then, uh, B cells are stimulated, stimulated. Okay. So by nuclear antigens to produce antibody against it. Against it. Okay. Therefore, production of autoantibodies. Autoantibodies. Okay. Okay. So, spectrum of autoantibodies in SLE. So, studies with B cells from patients with SLE suggest the presence of defects in both central and peripheral tolerance, resulting in a higher frequency of autoreactive B cells than that typical of for healthy people. Spectrum of autoantibodies in SLE anti-nuclear antibodies (ANAs) are directed against several nuclear antigens and can lead to and uh, hmm. The spectrum of autoantibodies in SLE anti-nuclear antibodies (ANAs) are directed against several nuclear antigens and can be grouped into four categories: antibodies to DNA, antibodies to histones, antibodies to non-histone proteins bound to RNA, and antibodies to nuclear antigens. Other autoantibodies against blood cells, including RBCs, platelets, and lymphocytes, are found in many patients. So, spectrum. So spectrum of antibody. So spectrum of autoantibodies in SLE. So we have various kind of antibodies. Okay. So in the patients with this systemic SLE, there we can see the central as well as peripheral tolerance. Tolerance. We can central and peripheral ANS can be are directed directed against several nuclear antigens. Okay. Uh, and can be and grouped under four categories. Four categories. So first is the antibody against antibody against DNA. Okay. Second, antibody against stones. Okay. Third is the antibody to non-histone protein bound to RNA. Antibody to non-histone proteins bound to RNA. Okay. And fourth is the antibodies to antibodies to nuclear antigens. Nuclear antigens might as well we can see antibodies against antibodies against RS red cells, platelets, platelets, and lymphocytes. Lymphocytes. Okay. Yeah. So, clinical manifestations. SL is a middle system disease that is highly variable in clinical presentation. Typically, the patient is a young woman with some, but rarely all of the following features: a butterfly rash over the face, okay, butterfly rash over the face, fever, pain and swelling in one or more peripheral joints, hands and wrists, knees, feet, ankles, elbows, shoulders, pleuritic chest pain and sensitivity, damaging of mucosa ulcers, serositis, pleuritis, pericarditis, endocarditis, and myocarditis. Subitis. Okay. So Clinical manifestations. Patient who is young, butterfly, rash on face, then fever, pain and swelling, peripheral joints. Okay, and pleuritic chest pain, pleuritic chest pain, photosensitivity, photosensitivity. Okay, damaging of mucosa, that is called ulcers. Ulcers. Okay, serosa, serosa, serositis. Okay, then we have the pericarditis. Pericarditis. Then we have endocarditis. Endocarditis. Then myocarditis. ठीक. So, a variety of clinical findings may point toward the renal involvement, including hematuria, red cell cast, proteinuria, and in some cases the classic nephrotic syndrome. Laboratory evidence of some hematologic derangement is common, and in some patients, anemia or thrombocytopenia may be presenting manifestation as well as the dominant clinical problem. Instead, other neuropsychiatric manifestations, including psychosis or convulsions or coronary artery disease, may be prominent clinical problems. कितना बड़ा है और now what it like renal involvement ठीक है then hematuria including hematuria then red cells cast proteinuria proteinuria um, classic nephrotic syndrome classic nephrotic syndrome okay laboratory evidence Hmm. Anemia, thrombocytopenia. Anemia or thrombocytopenia. Okay. Neuropsychiatric, neuro, neuropsychiatric manifestations, psychiatric manifestations like psychosis, convulsions, convulsions, and coronary artery disease. Coronary artery disease. Okay. So, patients with SLE are also prone to infection, presumably because of their underlying immune dysfunction and treatment with immunosuppressive drugs. Rare acute cases progress to death within weeks to months. More often, with appropriate therapy, the disease is characterized by exacerbations and remissions spanning a period of years or even decades. During during exacerbations, increased deposition of immune complexes and the accompanying complement activation are thought to result in a hypocomplementemia. The most common cause of death are renal failure, intercurrent infection, and cardiovascular disease. The incidence of cancer also is increased, particularly B cell lymphomas. Okay. Patients with SLE prone to infections, prone to infections. Okay. Because of immune dysfunction, dysfunction, and okay, and treatment with immunosuppressive suppressive drugs. Okay. T. Hmm. Rare acute cases progress to death within weeks to months. Rare acute cases can lead to death in weeks or months. Okay. T. More often with appropriate therapy, the disease is characterized by exacerbations and remissions spanning a period of years or even decades. During exacerbations, increased deposition of immune complexes and accompanying complement activation are thought to result in hypocomplementemia. Disease is characterized by exacerbations and remissions. Okay. In years or even decades. Okay. During exacerbations, increased deposition of immune complex and the accompanying complementation and the accompanying complement activation are thought to result in thrombo mm, in hypocomplementemia. Okay. The most common causes of death are renal failure, intercurrent infection, and cardiovascular disease. Causes of death. Uh, First is the renal failure. Then second is the intercurrent infections. 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 Then and cardiovascular diseases. Okay. The incidence of cancer also is increased. Incidence of cancer is also increased. B cell lymphomas. B cell lymphomas. Okay. So, organs involvement in lupus with lupus: kidneys, lungs, central nervous system, blood vessels, blood, and heart. Okay. So, organ involvement. So, what are the organs involved in the organs involved in SLE? Kidneys, lungs, central nervous nervous system, Then blood vessels, and heart. Okay, चलो हो गया. So SLE systemic lupus erythematosus, mala rash, the classic lupus butterfly rash. Okay, butterfly rash. Okay, manifests acutely as an erythematous elevated lesion, pur- pruritic or painful in a malad distribution. Okay, uh, commonly precipitated by exposure to sunlight. The rash may last for days to weeks. Is commonly accompanied by other inflammatory manifestations of the disease. Okay, ठीक. So mala rash. Morphological appearance in SLE. Here we go. So mala rash. Malar rash. Butterfly type rash. Butterfly type rash. Okay, and erythematosus. Erythematous. Elevated lesion. Elevated lesion. Um, Periodic. Okay, painful. May last. May last for about for days or weeks, and is commonly accompanied by other inflammatory manifestations of the disease. Commonly accompanied by other inflammatory manifestations of disease. Discoid rash. Okay. Occur in 25 to 45% of patients with SLE. Most common manifestations include the irregularly shaped raised white plaques, areas of erythema, silvery white scarred lesion, the ulcer with surrounding erythema on soft or hard palate, buccal mucosa. So, most common, most common manifestations: irregular shaped shaped raised white plaques, areas of erythema. Okay. Silvery white, scarred lesion, scarred lesion, then ulcer. Okay, on soft or hard, soft or hard diet or buccal mucosa. Finally खत्म हुआ चलो. So, Jogren syndrome. Jogren syndrome is a clinic pathologic entity characterized by dry eyes, keratoconjunctivitis, sika, and dry mouth, xerostomia, resulting from immune mediated destruction of lacrimal and salivary glands. Okay. It occurs as an isolated disorder, primary form also known as the Zika syndrome, or more often in association with another autoimmune disease secondary form. Okay. Another associated disorders, RA is the most common, rheumatoid arthritis is the most common, but some patients have SLE, polymyositis, systemic sclerosis, vasculitis, or thyroiditis. ठीक, इतना है और नीचे खत्म हो गया. Sjogren disease syndrome. Sjogren क्या नाम है बीच. Sjogren disease. So it is a clinic pathologic entity. Clinic pathological entity. Features are dry eyes. Medical term for dry eyes is kerato, kerato conjunctivitis, conjunctivitis, uh, Zika, Zika, okay, and dry mouth, which is called xerostomia. Xerostomia. Okay. Xerostomia. Okay. So, resulting from mediated destruction of lacrimal and salivary glands due to immune mediated destruction of lacrimal salivary glands. So it occurs in an isolated disorder, primary form, also known as Zika syndrome, or more often in association with another autoimmune disease, second form. Okay. So it can occur in two forms. It can occur in two forms. Primary form, primary form, Zika, Zika syndrome. Okay. And secondary form, secondary with another another autoimmune disease. So among the associated disorders, rheumatoid arthritis is the most common. Like most common is most common is rheumatoid arthritis. Rheumatoid arthritis and less common are SLE, then SLE, then polymyo myositis, systemic s- sclerosis, vasculitis, or thyroiditis. Okay. So, clinical course approximately 90% of estrogen disease syndrome cases occur in women between the ages of 35 to 45 years. Patients present with dry mouth, lack of tears, salivary glands are often enlarged as a result of lymphocytic infiltrates. Extraglandular manifestations include the synovitis, pulmonary fibrosis, and peripheral neuropathy. About 60% of estrogen patients have another accompanying autoimmune disorders like rheumatoid arthritis. Notably, there is an increased risk for developing of non-Hodgkin B-cell lymphoma arising in the setting of a initial robust polyclonal B-cell proliferation. See. So, Okay. So, 90% of cases are among women of age 35 to 45 years. Okay. ठीक. Okay. Um, presents with dry mouth and lack of tears. Patient presents dry mouth and lack of tears. Okay. Okay. Salivary glands are they are often enlarged as as a result of lymphocytic infiltrates. Lymphocytic infiltrates infiltrates. Okay. Extraglandular manifestation. Extraglandular manifestations. Manifestations include synovitis, synovitis. Then pulmonary fibrosis, pulmonary fibrosis, and peripheral neuropathy. Peripheral neuropathy. About 60% of patients with Sjogren disease have they have rheumatoid arthritis. They have rheumatoid. Okay. Notably, there is an increased risk for developing a non-Hodgkin B-cell lymphoma arising in the setting of initial robust follicular B-cell. क्या है ये? Hodgkin क्या है? नहीं पता मेरे को. जा, मैंने learn करूँ. Systemic sclerosis. Okay. Systemic sclerosis. Okay. So, is an immunological disorder characterized by excessive fibrosis in multiple tissues, obliterative vascular disease, and evidence of autoimmunity, mainly the production of multiple and autoantibodies. It is commonly called scleroderma because skin is a major target, but this disorder is better labeled systemic because lesions are present throughout the body. Cutaneous involvement is the usual presenting manifestation and eventually appears to in approximately 95% of cases, but it is the visceral environment of the gastrointestinal tract, lungs, kidneys, heart, and skeletal muscles that is responsible for most of the related morbidity and mortality. ठीक. Excessive fibrosis in multiple tissues. Okay. Obliterative vascular disease, vascular disease, and evidence of autoimmunity, and autoimmunity. It is commonly called scleroderma. It is it is commonly called scleroderma because the is the major target, but it also s- but it also like s- but it also spreads. What is wrong with me, guys? I can't pronounce this word. Spreads. What is it called? S- s- what the fuck? Is spreads, spreads, spreads. It spreads towards another, but it's but it is spreads, is spreads, but spreads to blood. So that is why it is called. So that is why it is systemic, systemic sclerosis. Is sclerosis. What? What happened? involvement. Cutaneous involvement. So apparently there is also cutaneous involvement in this systemic SCLEROS sclerosis involvement with the okay. Cure is the usual presenting manifestation and eventually appears in approximately 95% of cases, but it is a visceral involvement. Okay, so this is seen in 95% of cases. 95% of cases, but morbidity and mortality is due to GIT, gastrointestinal tract infections, gastrointestinal tract, lungs, kidneys, heart, and skeletal muscles. Okay, so systemic sclerosis can be classified into two groups on the basis of its clinical course. Diffuse derma, characterized by initial widespread skin involvement with rapid progression and early visual involvement. Limited scleroderma with mild skin involvement, often combined to fingers and face. Involvement of viscera occurs late, so the disease in these patients generally has a fairly benign course. Benign. Like, thick. So, classified into two groups. Into two groups. Diffuse is Xeroderma and limited Xeroderma and limited Xeroderma. Okay. Pathogenesis of semi the cause of disease is not known, but genetic and environmental factors probably contribute. Pathogenesis is the following: injury to endothelial cells. Okay, so pathogenesis. Now, pathogenesis of systemic systemic sclerosis is scleroderma. Scleroderma. is 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 scleroderma. Okay, nine. Okay. So first step in the pathogenesis is the injury to endothelial cells. To endothelial cells. Then there is a of small arteries by unknown mechanisms leads to endothelial activation, increased expression of adhesion molecules and migration of activated T cells into the perivascular tissues. The local T cells reaction may cause further activation and injury to endothelial cells. T cells respond to some self antigens and produce cytokines that activate fibroblasts and stimulate collagen production, resulting in fibrosis. Uh, Repeated bouts of endothelial damage followed by platelet aggregation leads to endothelial proliferation and intimal fibrosis, which together with periadventitial fibrosis narrow the small vessels with eventual ischemic injury. ठीक. T cells respond to uh, they respond to some T cells respond to some self antigens, some self antigens, and produce cytokines that activate fibroblasts, fibroblasts, and stimulate collagen synthesis and stimulate collagen synthesis. ठीक. Resulting in fibrosis. So repeated bouts. ठीक है. Repeated endothelial endothelial injury can cause ischemic injury. Hypothetical mechanism postulated for the production of fibrosis in systemic sclerosis. ठीक है. So first, there is a chronic endothelial cell injury with vascular compromise. ठीक है. Then there is chronic ischemic tissue injury, then chronic tissue repair, and it results in fibrosis. Okay. And primary immunological immune response, cytokine production and cell recruitment, growth factor production, fibrosis. So there is a crest syndrome. We can also see crest syndrome. Okay. So here syndrome. Ugh. See. Clinical course systemic sclerosis affects women three times more often than men, than with the peak incidence in the 50 to 60 years age group. The progressive collagen deposition in the skin leads to atrophy of hands, with increasing stiffness and complete immobilization of joints. T. It affects women more than men. Progressive deposition of collagen in skin leads to hands with increasing stiffness and complete immobilization. Difficulty in swallowing due to esophageal fibrosis. Okay. Malabsorption may appear in if the submucosal and muscular atrophy and fibrosis invade the small intestine. Malabsorption can occur if the small intestine is also in game. Dyspnea and chronic cough reflect and permanent changes with advanced lung involvement. Secondary pulmonary hypertension may develop, leading to right sided cardiac failure. Dyspnea, dyspnea, and chronic reflect chronic cough, signify pulmonary change. ठीक है. So advanced lung involvement can cause secondary pulmonary hypertension leading to right-sided cardiac failure. Okay, so local form of SS, that is a systemic sclerosis. Almost all patients exhibit Raynaud's phenomenon, a vascular disorder characterized by reversible vasospasm of the arteries. The hands turn white on exposure to cold, reflecting vasospasms, followed by changes to blue as ischemia and cyanosis. Supervene the color change to red as reactive vasodilation occurs. Okay. Local form of SS. So we have almost exhibit Raynaud's phenomenon of vascular disorder characterized by reversible vasospasms of arteries. So hands turn white on exposure to cold. ठीक है. Reflecting vasospasms. Then then it turns blue due to ischemia and cyanosis. Ischemia and cyanosis. Then when the color changes to red and reactive vasodilation occurs. Vasodilation occurs. Okay. Facial changes. Pinched nose, mouse cough, pursed lips, cannot evert eyelids, lip thin and retraction, immobile faces. Facial changes. Pinched nose, mouse cough. This is called as the mouse cough. Pursed lips, pursed lips. ठीक. Cannot evert eyelids. Lip thinning, lip thinning, lip retraction, and immobile faces. Immobile. Okay. Rheumatoid arthritis is a systemic chronic inflammatory disease affecting many tissues, but principally attacking the joint to produce a non-suppurative proliferative synovitis that frequently progresses to destroy articular cartilage and underlying bone with resulting disabling arthritis. Polyarthritis nodosa belongs to a group of diseases characterized by necrotizing inflammation of walls of the blood vessels, most likely. Distraction, guys. Polyarteritis nodosa belongs to a group of diseases characterized by necrotizing inflammation of the walls of the blood vessels, most likely caused by deposition of immune complexes. The general term non-infectious necrotizing vasculitis differentiates these conditions from those attributable to direct vessel infection, example an abscess, and serves to emphasize that any type of vessel may be involved arteries, arterioles, veins, or capillaries. इसका लिखेंगे रूमेटॉइड आर्थराइटिस के बारे में लिखेंगे Systemic chronic inflammatory disease. Systemic chronic inflammatory affecting many tissues. Okay, affecting many tissues, but principally joints. Principally joints to produce to non-separative 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 proliferative synovitis proliferative synovitis that progresses to destroy articular cartilage G, and bone T. Okay. Polyarthritis nodosa. ठीक सो पॉलीआर्ट्राइटिस नोडोसा क्या है ये बकचोदी पॉलीआर्ट्राइटिस नोडोसा necrotizing necro necrotizing inflammation of walls of blood vessels. Okay, ठीक by deposition of immune complexes. Okay. The term non-infectious necrotizing vascular differentiates this condition. Examples of immune causes. This is a summary. Systemic lupus erythematosus antigen involved is a nuclear antigen ANAs, nuclear antigens, and clinicopathology manifestation nephritis, skin lesions, arthritis, others. ठीक है. Post-streptococcal glomerular nephritis. Antigen involved is a streptococcal cell wall antigens may be planted in glomerular basement and cause nephritis. Serum sequence of various proteins, example foreign serum proteins like horse anti-thymocyte globulin. It can cause arthritis, vasculitis, and nephritis. Arthritis reaction experimentally various foreign proteins and can cause the cutaneous vasculitis. Now T cell. Thankfully, I have not so this fuck. Okay, let's shape this. So hypersensitivity for It is a delayed type of hypersensitivity, needs time to develop, and cause one chemical substances, soaps, poison ivy, okay, poison ivy. Wait, one second, I'll just copy this fucking thing and paste it in the notes. ठीक है. 4. Hmm. So causes one is the chemical substances like poison ivy, soaps, poison ivy, poison ivy, poison oak. So they are absorbable. That is, they can trigger the graft versus host reaction. Graft versus host reaction. Okay. Cause 2. So cause 2 include the intercellular antigen, pathogenic antigens. Intracellular pathogenic antigens. So mycobacterium tuberculosis viruses. Two types of T cell reactions are capable of causing tissue injury and disease. Cytokine mediated inflammation, in which the cytokines produced mainly by CD4 plus T cells, and direct cytotoxicity mediated by CD8 plus T cells. In inflammation, exemplified by the delayed type hypersensitivity reactions, CD4 T cells offer Th1 and Th17 subsets secret cytokines which recruit and act other cells, especially macrophages, and these are the major effector cells of the injury. In cell-mediated cytotoxic CD8 plus T cells are responsible for tissue damage. So, example is contact dermatitis. Contact dermatitis is an example of a tissue injury resulting from mediated inflammation. It is evoked by contact with penta dicycle. What is this? Penta dicyclotacol, also known as urushiol, the active component of poison ivy and poison oak, which probably becomes antigenic by binding to host protein on a re-exposure of a previously exposed person to the plant. Sensitized Th1 helper cells, CD4 plus T cells, accumulate in the dermis and migrate towards the antigen within the epidermis. Here they release cytokine that damage keratinocytes, causing separation of these cells and formation of an intraepidermal vesicle, and inflammation manifested as a vesicular dermatitis. ठीक है. So It has long been thought that the several systemic diseases like type 1 diabetes and multiple sclerosis are caused by TH1 and TH17 reactions against cell antigens, and chronic disease may be caused by uncontrolled reaction involving the same T cells but directed against the intestinal bacteria. So, uh, ठीक. So, hmm. It causes eczema, redness, and inflammatory processes. ठीक है. So, in contrast with immediate hypersensitivity, the detail that is the delay type hypersensitivity reactions is delayed for 12 to 48 hours, which is the time it takes for affected T cells to be repeated to the site of antigen challenge and to be active and to be. One sec, guys. I'll come. Is the charging fine? It is. So, in contrast with immediate hypertension, sensitivity, for the DTH reaction is delayed for 12 to 48 hours, which is the time it takes for effector T cells to be recruited to the site of a antigen challenge and to be activated to secret cytokines. The classic example of DTH is the tuberculin reaction elicited by challenge with the protein acid of a Mycobacterium tuberculosis tuberculin in a person who has previously been exposed to tubercle bacillus. Between 8 to 12 hours after intracutaneous injection of tuberculin, a local area of erythema and induration appears reaching a peak typically 1 to 2 centimeters in diameter in 24 to 24 to 72 hours and thereafter slowing subsiding. On histologic examination, the DTH reaction is characterized by perivascular accumulation cuffing of CD4 plus T helper cells and macrophages. Local secretion of cytokines by these cells leads to increased vascular permeability, giving rise to dermal edema and fibrin deposition. The latter is the main cause of a tissue induration in these responses. कितना बड़ा है रे यार और जो हाँ ओके चलो खत्म हो गया. So, delay type hypersensitivity. The tuberculin response is used to screen population for people who have had previous exposure to tuberculosis and therefore have circulating memory T cells uh, specific for mycobacterial proteins. Notably, immunosuppression or loss of CD4 T plus CD4 T cells example resulting from HIV infection may lead to negative tuberculin response even in presence of CV. Oh. T cell mediated cytotoxicity. In this form of T cell mediated tissue injury, CD8 plus CTLs, cytotoxic T cells, kill antigen bearing target cells. Class 1 MSC molecules bind to intercellular peptides, antigens, and present the peptide to CD8 plus T cell lymphocytes, stimulating the differentiation of these T cells into effector cells called CTLs. That is cytotoxic T cells. Cytotoxic T cells play a critical role in resistance to virus infection and some tumors. The principal mechanism of killing by CTLs is dependent on perforin granzyme system. Porphyrin and granzymes are stored in the granules of CTLs and are rapidly released when CTLs engage their targets, cells bearing the appropriate class 1 MHC bound peptides. Binds to plasma membrane of target cells and promotes the entry of granzymes, which are proteases that specifically cleave the and thereby activate cellular caspases. These enzymes induce apoptotic death of the target cells. Cytotoxic T cells play an important role in the rejection of solid organ transplants and may contribute to many immunological diseases like type 1 diabetes, in which insulin producing beta cells in pancreatic islets are destroyed by an autoimmune T cell reactions. Ah, guys, it's finally over. Fuck. Oh, oh my god. The live stream went from 0 minutes to 1 hour and 52 minutes. Okay, fine. So, bye guys. Thank you.